recording now. And with that, let's dive right in. So in terms of an introduction to the DRWG, this is a global coordinating body working to advance data responsibility across the humanitarian system. It's made up of stakeholders that are engaged in either the coordination or the implementation of humanitarian action and or operational data management. So this is really an operationally oriented group. The DRWG began as an interagency standing committee subgroup in 2022, and it was brought together to draft the first version of the IASC operational guidance on data responsibility, and we'll go into that in a bit more detail later on in the session. And then it transitioned into a system-wide working group in early 2021 after the release of the IASC operational guidance. And the primary aim of our group is to advance data responsibility as the approach to operational data management at all levels of the humanitarian system. And here, just to give you a quick overview of the membership. So the co-chairs for the DRWG are the Danish Refugee Council, IOM, OCHA's Center for Humanitarian Data, and UNHCR. And the membership, the 27 members you can see here on the screen. So what is data responsibility? It's defined in the IASC operational guidance as the safe, ethical, and effective management of personal and non-personal data for operational response in accordance with established frameworks for personal data protection. And this definition is key because it shows that data responsibility is just as much about mitigating the risks of humanitarian data management as it is about maximizing the benefits, so maximizing the potential. So with SAFE, what we mean is that data management activities must ensure the security of data at all times. They must respect and uphold human rights and other legal obligations, and importantly, do not cause harm. With ethical, we mean that data management activities should be aligned with established frameworks and standards for both humanitarian ethics, including the humanitarian principles, as well as data ethics. And then by effective, we mean that data management activities must achieve the purposes for which they were carried out. So this is really the maximizing the benefits of humanitarian data management. So why does this matter? Well, first of all, humanitarian organizations collect and share more data than ever before. And as I think we're all seeing in our day-to-day work, the technical tools that we have at our availability, they're evolving much faster than the policy instrument needed to govern their use. Secondly, the operating environments that humanitarians work in are increasingly characterized by digital risk and cyber threats. And in this context, irresponsible data management can place already vulnerable communities at greater risk. Finally, this is not something that any single organization can do on its own. So improving data responsibility requires both individual as well as collective action. And in a response, it involves upholding the principles as well as adopting actions at the organization, the cluster sector, or the system and the system-wide level. So in practice, this is based on the IASC's operational guidance on data responsibility in humanitarian action, which I already mentioned, first endorsed in February of 2021 as the first system-wide framework for data responsibility in the sector. And it includes a set of principles and actions for the implementation of data responsibility. And you'll get a quick overview of those in a second. The operational guidance was subsequently revised by the Data Responsibility Working Group and released, the revised version was released in April of last year. So the principles included in the IASC operational guidance, I won't go through all of them in detail. A lot of them will look familiar. They relate to, for example, accountability. So making sure that data management by humanitarian organizations is accountable both to the people we serve, as well as following internal accountability structures as they apply. Confidentiality, so making sure that any data that should not be exposed is not exposed, and these 10 other principles. In terms of the actions, which is really where the operational guidance is put into practice, here are the 8 actions that are included in the document. Again, I won't go through all of them in detail, but as you can see, they include actions like designing for data responsibility at the top right-hand corner, which means that before we start a data collection or a data management activity, we should ensure that throughout the data management process, measures are taken to make sure that we, again, minimize risk and maximize the benefits of data management. It also includes the data impact assessment action. So before we start an activity, doing a risk benefit assessment and looking at the impacts that the data management activity will have, both on affected people, the organization, and the broader system. So that's the ISC operational guidance on data responsibility. The other document I want to introduce is the principled framework for responsible data sharing between humanitarian organizations and donors. And it's important to note that this is not a DRWG document. This was not developed by the Data Responsibility Working Group. This was developed by the Humanitarian Data and Trust Initiative, which is a collaboration between the ICRC, OCHA, and the Swiss Federal Department of Foreign Affairs. And this group, together with a broad consultation of actors across the humanitarian system over the course of 2021 and 2022, developed a framework that sets out 6 guidelines for how to responsibly share data between humanitarian organizations and donors. And Aurélie Riem, who is with us from the Swiss Federal Department of Foreign Affairs, will go a bit further into this framework. So that leaves me to introduce our fantastic panel of speakers. I'll quickly introduce all of you in the order in which you will come in, and then we'll hand over to Ian as the first speaker to kick us off. So Ian Murray is the chief of the planning, research, monitoring, evaluation, and data section with UNICEF. Then Ian will hand over to Daunia Pavone, who's the Senior Data and Analysis Quality Advocate with DTM at the International Organization for Migration. We'll then turn to Esther Lee Stewart, who is the Operations Director for the Middle East region for DRC. And then finally, we'll move to Aurélie Riem, who is Program Officer with the Swiss Federal Department of Foreign Affairs. So with that, let me hand over to Ian for the first example of data responsibility in practice.
Thank you very much, Jos. And I'm the head of that section, but for the state of Palestine. So sorry that not globally, but responding to the L3 emergency here. So if you could skip to the next slide, Jos, that would be great. So talk about responsible data for children in practice here in the state of Palestine in the L3 emergency. Next slide. And just the context that we're facing with the emergency, everyone knows about the conflict that we have in the Gaza Strip, with the 2.3 million population there. We're considering about 1.7 million of the population is displaced, with over 34,000 people killed. With the food insecurity situation that we're facing in the north, including malnutrition. And since October, we've been facing a situation where we've been having 0 hours of electricity from the national system and almost a full communication blackout. Things are improving a little bit on that front now, but it's been incredibly difficult with the communication issues in that context across the Gaza Strip. Next slide. So some of the challenges we're facing on data is that electricity issues and internet that we talked about, and the difficulties of partners reporting because of that, and accessing information from the partners and from the field. Having very little visibility on what's on the facilities that have been repurposed particularly as informal shelters, better information on the government-controlled facilities and the UNRWA-controlled shelters, but many informal shelters which have been very difficult to map, know where they are, and having data on those facilities has been really challenging. And that relates then to the lack of unique identifiers for those facilities, and we also have a challenge of sharing of the GPS coordinates because they were sensitive both pre-conflict and more so post-conflict, specifically for the reason that the sharing of coordinates of facilities can lead to the military targeting of those facilities. So whether it's wash infrastructure could be used for targeting, or shelters, as we've seen in the news, many shelters have been targeted, which has also led to limited sharing of the operational data sets on including where those shelters are. And one of the issues that we're going to talk about is then around how we overcome that, and how we're looking at the mapping. So the next slide. The opportunities that we've had, right? So the mapping of partners' activities at the neighborhood level, admin 4, without the GPS coordinates, assessment planning, and then how we collect data through alternative data collection tools. So we went for the admin 4 data for mapping of where our partners are, because if we were starting to do the mapping at the locality level, it would be giving away the GPS coordinates on maps. Even if they were on fixed maps, they could still be possibly pinpointed for military targeting purposes. Um, so admin 4 was sufficiently detailed that we can use it for operational planning, but not giving the very specific locations. And we're going to talk also about point 3, and hence why it's highlighted. So using alternative data collection tools like Rapid Pro, Kobo, QR codes for online surveys, and mapping of service providers and data feedback from service providers. And that links to how we can also map our interventions at the locality level. Just to say that one of the challenges that this is also looking to overcome is that the assessments haven't been getting conducted in Gaza because of the huge needs leading to some of the ethical challenges of collecting data in Gaza, when we know that the population needs are huge. At the same time, we have these operational data needs that for specific interventions and implementation. So on that first point on mapping the partners, if you can go to the next slide, Jos, you can see on these cluster dashboards, and on the left it's about nutrition, on the right it's on health. The mapping has largely been done at governorate level for the first months of the response, which isn't really very useful operationally. It can tell good for reporting and dashboards, but not good enough for operational purposes. So next slide. What UNICEF tried to do was then, for our internal purposes and not for external sharing, was to take it at the next level down from the governorate level to admin 4, which is the neighborhood level, to then start mapping where our service provision was across the Gaza Strip, and trying to also then tie service provision at the facility level, which would be one level down, and creating a unique identifier. Unfortunately, we found that one of the challenges we had pre-crisis was the operational data sets weren't as good as we would have hoped for preparedness means. So the sharing of having unique identifiers for all different types of service locations wasn't the best, and then the admin 4 level wasn't as clean as we would hoped with the naming. So could have been some better preparedness actions taken to ensure the operational data sets. We took the decision to plan and map at the neighborhood level. Following that, we also found that the clusters have also pushed with their response monitoring model, and have also pushed towards neighborhood level mapping as the level which is commonly agreed that is safe enough for sharing without pinpointing specific locations. So what we did was then take this mapping on the next slide to a specific a tool. UNICEF globally has developed this tool called Geosite that we use for mapping, and you can see on this slide and the next 3 slides that we've got here mapping at the neighborhood level. This is mapping facilities and different facilities where they are present, not where we're implementing, but where there's presence of different facilities and the density of facility presence. Next slide. You can then see where UNICEF had partner presence across the Gaza Strip. This is obviously like not from today, but from about a week ago. So the density of where we are providing services is much more concentrated in the south, where there's more partners, more displaced people there, and much less in the north of the Gaza Strip due to the huge displacement, as I'm sure everyone's seeing from the news. And this really allowed us to see where those locations of concentration of service provision to try to be able to inform beneficiaries of where to go to access services. Next. Just another slide of mapping at the neighborhood level of again of facilities and partners with very specific locations here that we are able to map with the pinpoint locations, but this is where we're trying to really keep that particularly for these types of maps a bit less circulated, and this is sort of mapping of volunteer networks, for example, on this map. So next. We also then looked at a collection of that data at the neighborhood level and how we can use that to tie back to other forms of data collection. So using Rapid Pro, which is an SMS based tool, using Kobo, using QR codes. Despite the connectivity challenges, we found that people do have a sufficient connection to be able to provide low bandwidth solutions. So SMS, we've been getting feedback from our cash program through the cash vendors platform. We're able to see where beneficiaries are redeeming their cash. And through SMS and low bandwidth feedback channels, we've been able to receive thousands of pieces of feedback on the cash beneficiaries and how they've received the cash and some of their priorities, which has enabled us to sensitively and in a protected way to get feedback in real time, which isn't a full-fledged survey, but is responding to people who we've already got the details and the contacts for. Whereas through QR codes, we've embedded QR codes into some of our supplies that we've given out, and unfortunately received very little feedback because of the connectivity challenges that we faced in Gaza. Despite that, we felt that giving people the opportunity to provide feedback is a very important opportunity at this moment. You can see the flow on the right-hand side of this this slide is a Rapid Pro flow, which is how we form the questions through Rapid Pro and SMSs. I think the next slide is for Christiana to talk about. Yeah, over to you, Christiana.
Yes, thank you, Ian. I'm not officially one of the speakers. I will just very quickly frame what Ian just talked about in a bit of a more global context on data responsibility for children specifically. I work, so yeah, my name is Christiana. I work at the Responsible Data for Children initiative at UNICEF headquarters. The Responsible Data for Children initiative has developed principles together. It's a joint initiative between UNICEF and the governance lab at New York University, and we have developed these responsible data for children principles, which are aligned with the ISC operational guidance on data responsibility and humanitarian action. The difference is that our principles apply specifically for children. They are tailored for children, and they apply in all contexts. So not just humanitarian, also development contexts in all different kinds of countries, so high, middle, low income. The next slide, please. So In the case that Ian has just talked about, in the case of the state of UNICEF in the state of Palestine, this example is aligned with RD4C, with the Responsible Data for Children principles, in a way by taking into account all of the sensitivities that are attached to data, to GPS coordinates in this case specifically. So a very critical takeaway from our side is that is the importance of humanitarian preparedness when it comes to data responsibility and handling data responsibly, because usually when crisis hits, there's not really enough space to talk about this, as very often there are other things that are more urgent and more important in that specific moment. So it's important to be prepared and have clarity on how to handle data responsibly in these moments. So one of our principles, for example, is proportionality, and as we could see in what Ian has just talked about, is that instead of collecting, for example, more and more GPS coordinates, which are very sensitive, UNICEF in the state of Palestine went to a more granular level at the neighborhood level, and therefore, incorporated this principle of data responsibility, proportionality. That would be all already from our side, I think, Ian, unless you have anything else. Otherwise, yeah.
No, that's great. So I think we can hand over to Daunia Pavone from IOM. Thanks a lot.
Hi, thank you, Jos. Good afternoon, everybody. My name is Daunia Pavone. I work with the DTM for the organization, or the International Organization for Migration, IOM. And I would like to talk to you about how we in IOM, with the help of other organizations, clusters, sectors, have tried to implement data responsibility in practice in our data and response operations. You can go to the next one, yours, please. The next one. Thank you. And you'll see that we will talk about something called the PIMSA, which is the PIM support network that helps ensure or help the field manage the data, manage data in a safe, ethical, and effective way. If you go to the next one, please. So this work has started quite a long time ago, and we have developed together with, again, clusters, NGOs, UN agencies, and other actors, an approach and a process that works for DTM in particular, to make sure that we are collecting and then managing data in a safe, ethical, and effective way. This process and approach, this approach includes the process clearly that, for example, starts from the decisions, humanitarian decisions that we need to make, and not by writing questions. It's an approach and a process that revolve around clear roles and responsibilities of data providers, data users, experts, and decision makers. And it's a process and an approach that really pushes us to make sure that we use available data that are appropriate, and also that we use, when we collect data, we use the appropriate method and source for each information. And we believe strongly that in practice, all of this has a very strong impact on data responsibility implemented in our work. Next one, please. Jos. This is not a job that we've done alone. This is not a work that we've done alone. You see some of the partners and colleagues on the slide that cooperated and collaborated with DTM and IOM so that we could come up with the best possible way to support our colleagues in the field implement data responsibility in their operations. Next one, please. What we started with was really asking what data we really need for specific sectors, and how do we collect them, store them, analyze them, use them, etc., etc. And in the last 6-7 years, we have worked very closely with the experts, the subject matter experts, but also with decision makers and with our people in the field that collect data, so the data, really the data providers, in order to make this happen. We have now have a joint website where we have tools and resources for IOM, DTM, but also for the sectoral colleagues in other organizations in order to make this happen. And we're building on that together every year. Next one, please. This is really really harder for some of the sectors. Not all sectors are so immediately and intuitively easy to work with. And so we had to specifically develop a series of guidance, but also training material when it comes to what do we really mean when we want to collect safely and ethically effective and useful data for disability inclusion, for GBV, for child protection, and so on and so forth. Of course, we haven't done this alone because we are not the subject matter experts, so we worked with those that are the subject matter experts. And because this is a joint initiative and it's joint work, all of these resources are publicly available for anybody to use. Next one, please. We also then had to look at the how we do data collection and data management. And again, working with partners, and HCR and DRC are some of the people that we mostly worked on this together with, but also our internal protection colleagues. We try to identify different ways to, for example, mainstream protection principles in data analysis activities, so that our activities and our work in the field is ethical and safe and of course effective. Can you go to the next one? Just to highlight one particularly successful cooperation has given us this really important piece of work that a lot of the colleagues in the field are really finding very useful when they have to design data collection and data management processes, which has to do with what happens when we encounter incident disclosures in the field. Again, this is all public material you'll find online. We have videos, but we also have presentations that people can use with the, the facilitator manual that people can use adapting to their specific operation, their specific need. Jos, could you go to the next one, please? We just realized after doing all this work that that wasn't enough. It's not enough to work on guidance, even if it's very, very practical. We needed to do more. And that's why we pulled together a number of colleagues in IOM, not just data colleagues, but other colleagues, in something called the PIM support network. PIM stands for Protection Information Management, but we don't do only protection information management. We do a little bit more than that, and we definitely try to implement data responsibility in practice. Our vision as a network is to make sure that we collaborate and we push for an institutional approach to data responsibility and protection information management in IOM, and that we also have harmonized standards that derive from data responsibility and are applied throughout IOM work, as well as engaging affected population in our data collection and management work, not just treating affected population as a source of information, but ensuring ownership and ensuring health, other processes actually are implemented in practice. We have different working modalities. I want to mention the 3 main working modalities of the network. We advocate internally in IOM for needed policy structures, changes, and capacity to be in place. But we also then work directly with our field colleagues to support, to coach, and to build the capacity of our colleagues. And then we look at where gaps in guidance and tools exist, try to find the best guidance that is available, and if not, try to find the right colleagues to develop that guidance together. So in a way that is useful for our colleagues in the field. Next one, please. The process we have designed to work with colleagues in the field is very light on the field. We try to understand what their constraints are through a very short set of information questions that we ask them in advance. And then we work with them through identifying solutions to help them overcome their challenges and ensure that the data activities are really ethical, safe, and effective. Next one. What we do is it depends on the request from our country offices. I have listed a few things we've done in the past few years. We do guide colleagues when it comes to identifying what data is really needed. And doing so, I'm pretty sure we are implementing in practice some of the data responsibility principles, if not all. We facilitate cooperation in the field with our partners, clusters, and other agencies at country level. We jointly identify appropriate methods and sources for the data that are necessary, so to try to ensure quality of the data and effectiveness of the activity. We leverage, or we help our colleagues in the field leverage existing data to enable analysis. We worked in the past a lot to help around the issues of informed consent, both from a process point of view and by developing and sharing existing tools. We also do a lot of reviewing of data collection tools and further management tools and systems. Again, we work on some of the issues that I've told you before about accountability to affected population when it comes to involvement in data and analysis activities. We also support on data protection for personal data. We do other kinds of support that are linked to the PIM-SUN, the PIM support network, that have to do with developing systems and tools. For example, we have just finalized a huge review of the data dictionary in DTM to make sure that our questions in all our tools are aligned with ethical principles of data responsibility, they're safe, and that our colleagues are able to use them in a way that provides the right data for them. We're also finalizing a PIM handbook for humanitarian context, where all the guidance that has been developed so far with our external internal partners is captured to help and guide colleagues in the field. Next one, please. Who is the PIN SUN? It was yes.
Sorry to interrupt, but we do need to move to Esther. I want to make sure that Esther and Orly both have enough time. So if you could.
So maybe just slide the last slide. So what we have learned so far is that we need to work together, that we need to provide alternative solutions that are practical, that we need to make sure that the purpose of data collection is clear before we try to provide the data or collect the data for it. And then the last slide, please, Jos, is that we cannot do this alone. And so we need to build on existing strong relationships with partners outside IOM, which are the clusters, which are the NGOs that work in the field, which are the other UN agencies and colleagues. I put down the PIM support email, if there is any type of questions or ideas that you can use. And with this, I hand over to Esther from DRC.
Great, thank you very much. I'm the Operations Director for the Middle East region at DRC, and I am joined online by Katrine, who is our Head of Protection Unit in headquarters. So our challenge at DRC in the Middle East is that we have been seeing an increase in requests for data sharing from governments, UN agencies, and donors. And these requests concern a wide range of data, including personal data, usually about the affected people and staff. As DRC, we're fully committed to and fully subscribe to the IASC principles for data responsibility and humanitarian action, national data protection laws, and as an EU-based organization, we are bound by the personal data protection principles of EU GDPR. However, we are challenged in managing these requests when, for example, a UN donor, which is not obligated to comply with GDPR, requires us to share data in a way that would be in breach of GDPR. And this is especially challenging when the UN withholds funding from DRC for this reason. We actually face a number of these challenges in the region from different UN and government entities, and this continues to be a challenge requiring tough decisions and finding ways to receive funds while ensuring compliance with legal obligations. One incident is with regards to a UN-funded program in one of our countries in the Middle East region. According to our grant agreement with this agency, DRC was required to share full beneficiary data with the donor and their vendors. However, in hindsight, we did not check thoroughly enough how we were to share the full beneficiary data. After our project was completed, the donor required us to electronically share full and unredacted beneficiary data to their third-party auditors. We understood that if we did this, we would not be in compliance with GDPR, and we're even more concerned as we were aware that the third-party auditors of this UN agency had actually previously been raided before by the government, and the beneficiary data taken from the auditor by force. In this context, there are clear risks to beneficiary safety due to the absence of a legitimate government, while sharing the data in this way would also be a violation of their provided consent. So we tried to negotiate various alternatives, such as allowing physical access to the select data samples, such as showing the data to the auditors on our computer screens, redacting the data, or using coded data and inviting the auditors to randomly select some for full assessment after we called the beneficiary to obtain consent. Although the auditors demonstrated some flexibility to accept these options, the donor did not agree to the alternatives and instead informed us that any delay in electronically sharing the unredacted data with the auditors would result in our project remaining unclosed and would result in increasing our risk status as a partner. And this increased risk status would then reduce the funding that we would be eligible to receive in this country. So we had multiple meetings with the donor in attempts to negotiate a mutually agreeable alternative, but the donor informed us that other INGOs provided this data, that in fact DRC and other countries provided this data, and therefore DRC in this country had no option but to provide the requested data. So what was our solution? Well, we first elevated this amongst various channels in our headquarters, and we decided to draft a data sharing agreement that defined the common commitments to data transfer. However, we did not have a consensus internally as DRC with regards to consent. The challenge being that consent could not be given in blanket approach, and we would need to specify consent regarding DRC sharing data with the UN agency, DRC sharing data with the third-party monitors, and the UN agency sharing data with a third party. We also required a consent form template with wording in plain language about who will be accessing the data and what for. Another element was whether consent was truly freely provided by a beneficiary who was required to consent in order to receive assistance. This is a broader concept that needs to be unpacked as it relates to data protection and the humanitarian response as a whole. So the impact. While these important topics were being discussed, unfortunately, the donor decided to increase our risk rating, and we remain ineligible to be considered for further funding from this donor. But on the plus side, this challenge and these lessons learned led to the development of our global DRC position on personal data sharing, which we will use to guide our interactions with future requests for data sharing from governments, UN agencies, and donors. The paper is based on the principles of IASC operational guidance on data responsibility and humanitarian action and GDPR legal obligations. Derived from these principles and legal obligations, for DRC, it is therefore essential to always engage in thorough analysis of purpose, benefits, and risk of the data sharing, while expecting a clear description of the standards and safeguards and utilization for the data before the data can be shared. Guided by the IASC principles, the extent of data shared should be balanced accordingly. For DRC, the principle of data minimization is imperative, and if the risk of harm cannot be mitigated, at least sensitive data should not be shared. Our lessons learned or quite a few actually. One is we need to be very clear from the outset on the grant management with regards to data sharing of personal data and other sensitive data and establish data sharing agreements to address this. Also, we need to be very clear with ourselves on our red lines and whether or how that would affect us applying for funds from the specific donor, and in this example, this UN agency in the first instance. And this includes being proactive about identifying or renegotiating these commitments prior to signature, as we've done with other donors since. Ensuring that data responsibility is a joint responsibility is critical to move forward on protecting our communities that we're here to serve. We also learned that we need to finalize our escalation mechanisms within DRC to be able to reach agreement more quickly. And we need to socialize our global position on data sharing amongst all DRC countries. And lastly, we learned that we do need broader buy-in or consensus from the donor community, especially the UN actors, as this issue is most prevalent with them, regarding these commitments for humanitarian actors and their shared responsibility for ensuring data protection and thus overall protection of the most vulnerable population groups in crisis situations. I'll hand over to Aurelie now.
Thank you, Esther. I hope everyone hears me. Thanks a lot for inviting Switzerland to this panel. It's great to speak alongside such inspiring panelists, and I think this issue is getting more important by the day with the rise of AI as well. So just to briefly return to what Esther just said, because I think it's also relevant for my example. So obviously the scenario of getting your risk rating higher is not consistent with the framework that Jos just presented, and so we can see that there's much room for improvement, and hopefully events like these can continue to draw attention to the issue. So from the Swiss perspective and from the donor perspective, I can also speak to the challenges of data responsibility. I think there's a lot of links to be made with all that's been said before. In terms of our response to the challenge, the impact of our response, and the lessons learned, I've seen many different things that overlap with what we experience as a donor. So the challenge that we identified is something that Jos spoke to earlier, and it's that in our internal conversations and also with external partners, we became aware that not only increasingly more data is collected, but also in many ways donors are driving this collection and analysis. And that's something that we became aware of, especially at the end of the 2010s, so I'd say around 2019. And that's the main concern that we identified was what was just mentioned by Esther, so the sharing between states and humanitarian organizations of disaggregated data that can lead to risks for the most vulnerable populations, and obviously privacy and protection concerns. So the response is Switzerland as a convener, we started collaborating with the OCHA Center for Data for Humanitarian Data and the ICRC in a process that Jos described as the Humanitarian Data and Trust Initiative. And the goal was to really convene other donors, organizations, academia, etc., to discuss what would be most useful for the sector and for donors. And the main outcome of this diplomatic initiative is the framework. And yeah, the principal framework is about setting standards to avoid the type of situations that was just mentioned. And I think it was Dania who mentioned capacity building, and I'd say that the main impact of this process was capacity building of our staff. So that was done through workshops that we did with OCHA and the ICRC, and the workshop also helped raise awareness, and on a political level, not just internally, in our bilateral discussions with other donors, in multilateral discussions at the UN, we try to always raise the agenda of data responsibility. And of course, the third big impact is gradual implementation of and mainstreaming of the framework and data responsibility in our daily business. So I'd say that as a result, we have now in-house our data protection champions and the alumni of the network who really are raising awareness around this issue and are sensitizing staff. And they're also being sent to other organizations as secondees, and they're taking the work there as well. On top of that, we are also reviewing our internal toolbox for data management. And I think it's a great opportunity because it's slightly outdated. It's a great opportunity to raise the profile and promote the framework in this new toolbox. I also have a concrete example, and we had one project officer who was working on an agreement with a partner, and the project relied on interviews of people in a displacement context. So the data was quite sensitive. It was personal data, and it involved, on top of that, analyzing that data with using artificial intelligence and large language models. So with advice from our data champions and our alumni group, and it's a good thing that she was aware that we existed, and based on the principles that were laid out in the framework, she and the partner could work on an annex to the contracts, to the grant contract. And from the Swiss side, we could propose amendments such as clarifying the purpose of data collection, raising the issue that this information was also stored on a cloud owned by a big American company, the fact that the large language model was used, and that's something that was also an external service, was an issue for us. But on the other hand, we were satisfied that some other elements that are present in the guidelines, in the framework, were present, such as minimization and data deletion. So we didn't need to add that. But this is just one example of how we can take small steps to advance data responsibility. And it creates a practice, and it sets a standard, and it builds capacity. So just to end on lessons learned, I think we realized how ambitious actually implementing such a framework can be, both for humanitarian organizations and donors, because it's a complex issue which requires an investment of time, attention, technical expertise. I think, as Esther said, there's also a lot of difficulty escalating this quite technical issues. At least for us, we need to also identify who the right people in-house are. And related to that, we really need a culture change, and it's happening now in real time. We can see it, but we still have to make more efforts to raise attention, because this issue is not going anywhere. And this is why we're doing advocacy based on the framework, both bilaterally with other donors and on the multilateral stage. For instance, now we're negotiating the UN Global Digital Compact in New York. And I noticed that the draft did not include any reference to humanitarian data. It only spoke about development data. So we're trying now to include this language to raise attention and to make sure states and other organizations are aware of that. So to conclude, I think we're heading in the right direction, but obviously it's not going to happen overnight. But I'll stop here, and back to you, Jos.
Great. Thank you so much for that, Aurélie, and thank you to the other speakers as well. I mean, it's been really sort of insightful to get these different perspectives, but all related to the same sort of overall topic of data responsibility. I mean, first hearing from Ian on some very concrete design decisions in setting up a data management activity under exceptionally challenging circumstances. And then moving to Daunia, who told us about the PIMSUN network. And I'll ask just a follow-up question to Daunia in a second. But it was great to hear how this network is helping to raise awareness of the issue of data responsibility, both across IOM and I think the broader humanitarian community. And then also how this network can be used to provide support, so really practical support to operations. And then moving to Esther and Aurélie to speak specifically on this dynamic of data sharing with donors, some of the challenges involved in that dynamic, as Esther was describing. And then also just the very significant role that donors play in data collection and data sharing in humanitarian operations. So I think really interesting and in distinct perspectives, and all coming back down to just sort of the same overall topic. I'm actually not able to see the chat. So if there are any questions, then Fanny, it would be great if you can just give us a heads up. And while maybe you go through any comments that we may see, and all of the participants are of course invited to ask your questions. Maybe while we wait for some of those questions, it would be great maybe first to hear from Daunia a bit more about, let's say, any advice that you would have for other organizations that are interested in setting up a network similar to the PIMSUN. Are any sort of lessons learned that you would like to expand on a bit? Any mistakes that you would not want other organizations to make? Yeah, curious to hear a bit more. So Daunia, back over to you.
Thank you. Well, I think the first lesson learned is the very various skill sets that need to be brought around the table. We have protection experts, we have data experts, we have legal officers. We link very closely with ICT for some of the work, some of the solutions. We have, GBV experts. So you do need to bring around the table the right people. You also need to be mindful of people's time on the field, and therefore that means that you need to do a lot of the work, the prep work, before calling for a joint session and trying to work out some of the challenges. The other thing that we have learned is that it's much easier to, let's say, change the way people work in the field if they have not worked in that way for many, many years. So it's very, very conducive when you start working from the beginning with somebody in a way that makes sense for that is helpfully conducive to implementing data responsibility when they go to the field. So we have examples of people who started as interns and now they are working as coordinators that are able to implement data responsibility in every step of the data collection and management process. And that's easier to do when somebody hasn't done certain things in a certain way for 20 years or so. So I think those are some of the lessons learned. The main challenge we're facing is we have, as DTM, we work in 100 countries. And so that is a problem of resources, and it's not easy to be able to spend the time that you need to spend, because you need to know that you need to spend a lot of time on it. Coaching and understanding what the challenges that people in the field are facing are in order to come up with practical solutions. Over to you.
Thank you for that, Dania, and really clear. I think it's also very recognizable to us at OCHA as we try to support the office to adopt data responsibility across our offices. I think in addition to what you already mentioned, one way in which we've seen data responsibility adoption really gain traction is by our colleagues implementing a solution for data responsibility in one context, and then if they move to another response, they are more likely to, of course, be familiar with the work and also see the value in solving an issue in that new response.
And just
really
to add,
helpful.
I think the framework with that you did, you worked on with the donors is a big help, because donors are can be our allies in implementing data responsibility in practice, but they can also be the ones that we have most challenges with when it comes to, for example, data sharing. So the more we can cooperate also with donors, the better. Over.
Great, thank you for that, Dania. And again, agreed. And we also see this in our operational support. So we're aware of specific donors requiring their funded projects, for example, to produce data for the overall benefit of the response. So really making proactive data sharing, of course, safely, ethically, and effectively, making that part of grant agreements can really support the data ecosystem in a response. I also wanted to check with one of the other co-chairs on the DRWG, Katrine. Any questions or comments for the group?
Yeah, so thank a lot, speakers. And I think I wanted to add to, I think what these 4 different diverse experiences and lessons learned really illustrates. I mean, there's part of data responsibility is indeed on the internal lines, so to speak. And as we saw, including also from Esther in DRC, I mean, in terms of getting the house in order, so to speak, and building on the yes guidance with the principles and not least the actions of thinking about data sharing and data sharing agreements concretely upfront and early on. What it also points to, or what is really a key message for me, is that data responsibility is indeed a joint responsibility. And I think the whole collaboration between us as operational humanitarian actors, with the donors, with the different, UN and NGOs and so forth, I think as we move forward, this both understanding and also importantly recognition of the different status, the different mandates, and the different roles we play when it comes to data management. Because without that understanding and subsequent also recognition, it will be super difficult for us to move forward on data responsibility. But I think this whole understanding, and supported by the YES guidance in terms of the actions, not least, but also the principles, of course, understanding that we play different roles. We have different statuses, some with privileges and immunities, others not, someone covered by the GDPR and so forth. And understanding for what we need the data for and so forth, and understanding the complementarity between us in our different roles. I think this is really where and how we need to move it forward. So these discussions like today is super helpful in terms of exactly coming together as operational organizations, as donors, and as states also, in terms of figuring out how we together can make this a joint responsibility and not something that each of us individually are being challenged, but also work to seek to find solutions to. So thanks a lot for this.
Great. Thanks so much for coming in, Katrine. I don't think we have any questions from the group, which with the last minute remaining, and just gives me a final minute to extend an invitation to any organizations involved in the coordination and implementation of humanitarian action, operational data management, so really, operational entities, to join the DRWG, and that involves serving as the focal point for this organization, participating in the activities of the DRWG, including a quarterly call, contributing individual expertise where necessary. So we regularly have our members share draft guidance or draft documents that they're working on with the group for feedback. And then identifying and supporting connections between the DRWG's activities and other related or complementary initiatives. So you see the contact information of the Center for Humanitarian Data here, and we can make sure to add you to the DRWG's list. And there's also a forum on the DRWG page on Relief Web, and I've linked that on the HMPW site, which I realize is a lot of acronyms, but I'm sure everyone knows what I mean. And with that, we've come at time, so exactly within the allotted time frame. We just leaves it for me to thank the brilliant speakers. So Ian, Daunia, Esther, and Aurelie, thank you so much for your contributions. And of course, Chrisana and Katrine and everyone else who sort of came in as additional speakers. And thank you to our audience for joining us for the session today. We'll post a recording of this session on the HMPW site. And as I mentioned, there's also several resources there, including the ISC operational guidance and the principled framework for responsible data sharing between humanitarian organizations and donors. Thank you all for your time, and have a great rest of the HMPW.
Thank you. Bye.
Thank you very much. Bye-bye.
Thank you. Bye-bye.
Thanks, everyone.